From politics, a national dialogue on Nigeria's pandemic fund application is set to secure funding to improve the country's preparedness and response to potential pandemics. Experts believe the meeting is in view of a treaty for pandemics that will help to set the global standard for strengthening response. TVC News' Kemi Balogun reports.
The lessons learned from the COVID-19 pandemic has continued to spur preparedness against future public health threats and emergencies. Proactive measures to addressing emerging and re-emerging diseases remain key to the response outcome of outbreaks, including pandemics. This national dialogue by the Nigeria Center for Disease Control and Prevention, alongside other health partners, is a way of proposing a fund that will comprehensively outline strategies on early warning, disease surveillance and laboratory systems.
And while at the global level there are conversations around a new pandemic treaty, we have to also do our work domestically. And we hope that soon there will be an agreed pandemic treaty to strengthen global health security in the lines of responding to the lessons of COVID-19. But here in Nigeria, we know that every day we have small outbreaks. It is outbreaks that grow into epidemics and into a pandemic.
When eventually the next pandemic hit, what we decided this May would have played a major role. And what we are doing here today is also part of that.
Experts here highlight the need for the effective creation and implementation of the pandemic fund in order to not only strengthen health security, but to also protect global public health.
It is work in progress for the country to be where we should be when it comes to pandemic prevention, preparedness, and response. This grant cannot solve all our problems. It is clear to understand that. But we need to prioritize because there are other opportunities coming.
One of the challenges that we are facing is the multiple of outbreaks that we have. Meningitis in some of the northern states, Yobe, Bauchi, etc. Last year we had the diphtheria outbreak in Kano, etc. We have as well measles outbreaks in Borno, Adamawa, a lot of them. So, but you know that the best outbreak is the one that is responded as soon as possible and is not in the news because they don't spread. Right? So this is where we need to move, and I really think this proposal is a great opportunity for that.
The role of community workers and effectively equipping them for infection, prevention and control are two key areas that are on the top of the list for those at this gathering. Kemi Balogun, TVC News, Abuja.